Again, my name is Dr. Brian Carr, and I'm a licensed psychologist and glad that you can join us tonight for our continued discussion about healthcare reform and many of the issues that we face not only as a nation, but also here in our local Lubbock community. As always, we have enjoyed the benefit of having some very distinguished panelists, and I think again tonight we've got a terrific trio of individuals to come in and talk with us about what they see as some of the issues at hand and some of the solutions that we have and maybe some of the problems. And so to start off with tonight, what I'd like to do is let's reach across the table here and frame up, pull in a little bit there on. Go ahead and zoom in there for me, Chris. There you go. Joining us tonight is Dr. Robert Carr. Dr. Carr is my father, and he is a longtime pediatrician, now retired here in Lubbock. Arrived in, 1952, Dad, to start your practice?
That's right.
And so we can say that here we have a perspective of 57 years, I think if my math is right. So that's a lot of time to kind of give us some ideas, so we're glad that you're joining us tonight. To his left, then, we have John Brock. John, we're pleased that you're here with us. He's 5 years, administrator of North Star Surgery Center, undergraduate in business, master's in health administration, and then I didn't press you for details, but you said hospital administrator for many years.
Many years.
And you still have some black in there with the gray.
Very little. Very little.
We're pleased that you're joining us.
Thank you. My pleasure.
And then to his left, moving further across then, we have Dr. Ted Hartman. Ted is a medical educator of many years. Dr. Hartman, glad you could join us. Started the orthopedic program at the medical school at Texas Tech. Later brought in, served as dean of the medical school. And then after retiring, if that wasn't enough for all of what you had experienced through those years, you later went on to become the medical director of Blue Cross Blue Shield of West Texas. So, sir, we're delighted that you could be here with us tonight. And then, as always, to my left, we have Dr. Mark Scioli. Mark, you're a busy guy. Here again, just in time to sit down and talk with us. As always, very animated. I imagine you'll be giving us some good stories to talk about tonight. A lot of things happened in Washington this last week that, if necessary, we'll hold you down on the chair and
hold me back.
And get some good comments from you. But we're very pleased that you are hosting this, particularly in your wonderful house. So thanks so much. To start off with, let's talk about, we saw a lot of changes in Washington this week, the passage of the bill that now has advanced to the Senate. I think, though, as many people would say, it's not over yet, and we all know that you don't want to see them make hot dogs or laws, as one politician once said. So I don't know quite where it will go, but we're in the midst of change. So I'd like to ask my first question to John. John, as administrator of a care facility, that you've got a lot of forces on you from all different directions. The politicians want to pass laws. You've got a medical staff that you're trying to work with and coordinate, provision of care, the regulatory agencies that come in. What is your sense about, do you have a concern about a bunch of new mandates coming down, difficulty of trying to continue to run your operation when there's all these new requirements that may come out of Washington?
Well, Brian, I think there are a lot of things that are of great concern. I think any time the government decides they're going to take over and operate something, we've got issues. That would be first and foremost. What I think a lot of people don't understand is that our industry is probably as regulated or more so than any industry you could find. There's so much bureaucracy, and what I perceive with this is that it would just become that much more in your face. I mean, we have challenges all the time based on reimbursements constantly being reduced annually from payers, and the cost of delivering the care just continuing to go up. A high percentage of our expense line items is medical supplies, because as a surgery center, all we do are operations, medical procedures, and we do a lot of orthopedics, we do a lot of urology, and we use a lot of medical supplies in doing those cases. And it would appear that the medical supply companies are kind of coming off really well in this, because they're continuing to raise their prices, And we have to have their product to do what we do. And so once again, the expenses continue to rise. The reimbursement decreases on a regular basis. And it's an incredible challenge. It's amazing how much this has changed in the period of time I've been doing what I do.
Dr. Hartman, you've led the flagships of not only a tank in World War II under General Patton, a great story there, author of your adventures in those years in World War II, but I wonder if you've also, in a sense, fought some other battles as dean of the medical school, and even on the other side in terms of dealing with Blue Cross Blue Shield and trying to come to some peace about it. Your thoughts about regulations and our attempts to rein in some of this?
Well, it's certainly very clear that in earlier years of starting the medical school here, the regulations that were put upon us by different programs that were set up in Washington were much less present than they are today. It's very clear. Even our research programs, we had certain things that we did in the way of our research programs that we were controlled by our own honesty and our own understanding of what was fair to the patient. Today, there are many controls on us that won't even let us do those things, which we know have been honest in trying to get better treatment for patients. Those things have even gone by the board, so that there are controls that come with any kind of research grant now. So many of the research grants come out of Washington, and where those research programs have so many controlled things about them that make it almost impossible to make new discoveries about new treatments for various disease processes. And that has just increased and increased beyond orders.
How much do we find, Dr. Carr, in your years of practice? You talked about in one of the first videos that we had, you said an office call to your office when you first opened the clinic was $3. A shot of penicillin, which was your primary defense, was $1. It was really between you and the patient. What are some of the concerns you have now about who's between you and the patient? One can argue that, well, for many years maybe we've had many other forces, and I'm not so sure that we're maybe moving insurance out as maybe we're just simply moving government in along with insurance and medical equipment people and many others. Do you have these kind of concerns about who's between the doctor and the patient in this evolving debate?
Oh, absolutely. I think that it used to be a clear chain of authority that you and the patient were the only two involved. Very little insurance did I have when I first started in practice in the mid-1950s. And then as we got more and more rules and so coming in, then it became harder to practice the medicine as you wanted to practice. For example, I can tell you this one in my own experience. I mentioned last time that I did a lot of work at the Community Health Center here in town in the early 1950s and 60s and so when I first came here. And the government came in and said, now you doctors have been coming over to this clinic and doing this for free. We very much appreciate it, but now we're going to pay you for doing it. And we think it only fair that since you're spending your time and your professionalism in this clinic taking care of the children, then we will pay you a certain stipend for each child. Well, that sounded very good. I mean, obviously, to be able to get a little more income in on the time that you spent there. But then we found that after they started that, within a very short period of time, they would say, well, we can't just let you see the number of patients that you've been seeing. For example, if you saw 12 to 15 patients when you were there in the afternoon, you now should probably go and see about 20, 25, because we have a lot more that need to come in. So you didn't have as much time to give to them. They also